Welcome to the Implementation Cooperative Agreements for Expansion of the Comprehensive Community Mental Health Services for Children and Their Families Program and Planning Grants for Expansion of the Comprehensive Community Mental Health Services for Children and Their Families Program webinar. Today's webinar will focus on program history and RFA general information, after which we will have a brief question and answer period to focus on eligibility questions. We'll then move to tips for writing a successful proposal, strategic framework and tools for system of care expansion, evaluation of the CMHI expansion planning grants, social marketing, youth involvement, family involvement, cultural linguistic competence, tribal considerations, and then we'll end with a question and answer section again. To start us off, I'd like to welcome Gary Blau, Chief of the Child and Adolescent and Family Branch of SAMHSA's Center for Mental Health Services. Gary, take it away.
Right, can you hear me?
Gary.
Okay, phew, because I was nervous there for a second. Hey, well, thank you, Michelle, and to everyone who worked hard to coordinate this RFA applicant webinar. And this year, we obviously have combined our efforts to work very closely to create what are the CMHI, or the Children's Mental Health Initiative Expansion Planning Grants, as the Children's Mental Health Initiative's System of Care Expansion Implementation Grants, and combine those two into this one webinar to give people sort of the what we are trying to accomplish here at SAMHSA in order to effect change. Go to the next slide, please. Now, as you're going to learn today about how to apply and how to make it better. Your applications better. You're also going to get a little bit of background from me about where SAMHSA is coming from, because ultimately you need to address the issues that SAMHSA has, because that's what we're going to be telling our reviewers. As most folks know, once the deadline for your application comes to pass and you submit your application, then we have external reviewers and we turn everything over to our grants review operation. So our program side manages things and includes questions and answers and the like in coordination with our grants management folks. But once it hits the deadline, we have an entire separate grants review process and a separate review activity. And you're literally writing applications in order to ensure that the grant reviewers understand what you're trying to accomplish, all the details, because they'll be comparing your answers to what they're told by SAMHSA in terms of what we're looking for, and specifically about the screening criteria that we have. I always tell people that are doing this, myself included. Some of you know that I've written these applications before I came to SAMHSA 10 years ago, and so I have had experiences now on both sides, and I always will say default to the scoring criteria, because that ultimately is what our reviewers use in order to give you points. And the people with most points win. I mean, that's just the nature of it, and we are expecting a good competition this year. Bring up SAMHSA's strategic initiative slide and talked around it for a minute to give folks an opportunity to see the areas that we're focusing on at SAMHSA in general. And the Children's Mental Health Initiative and our focus for systems of care really do fit across many of these strategic initiatives. In particular, we identify trauma and justice and recovery supports. And because what we are attempting to do is to build an ability through our systems of care networks to have young people recover and lead productive and healthy lives. Obviously, in today's world, we're addressing issues regarding health reform. We still have a component of our strategic initiatives that deals with the military, and as many of you know, we're taking our 4 into electronic activities, whether it's health information technology, virtual learning, things of that nature. So all of these strategic initiatives, and you'll see that when you link what you're trying to accomplish with a SAMHSA strategic initiative, that helps the reviewers to better process your grants. And so I always will say definitively that it's important that you know who you're writing for. Now, these are, experts in the field. Most of them, of course, have expertise in our fields and backgrounds, although, some may have general expertise. And so really thinking through the application and what you want to say, how you want to say it, to get those really critical messages highlighted so that grants reviewers know what you're hoping that they're getting out of your application. So anyway, those are the SAMHSA strategic initiatives that we are focused on. Again, as it says in RFA, and our real focal point, because of so many of our youngsters having issues regarding trauma in other systems, that's a highlighted one, as well as recovery. So those two, but obviously we do other things as well. So those, next slide, please. Now, we are really focused on, and whether you're applying for a planning grant or an implementation grant, I really reflect back on what we're trying to accomplish here, which is to take this idea of a system of care approach, this framework that has been with us now for, over 20 years, then we've been able to demonstrate that's worked, to take it from this proof of concept, which we have all the way through wide-scale adoption, which is why our program fits well into the SAMHSA overall theory of change, is because we have gone through so many of these steps. And what we really want to do through a planning process, grant one, or the implementation process, or the second one, is to really push on people to broaden the scope of systems of care. So, even if you're a city, for example, interested in applying, which is perfectly acceptable, the idea here is to say, how then do we grow this, and do we do it beyond our location, and to get other folks involved? Or maybe you're a consortium of cities or counties or whatnot, or a state. How do we implement it across? How do we use our pilot activities to really push on that we have support from a broader geographic area, so that we really begin to take what's working in systems of care, move it beyond this innovation and dissemination to implementing and more wide-scale adoption. So that's the reason that we've modified the program from the original CMHI, which was a 6-year program, a 6-year grant, to now having a planning component, which is the 1-year planning activity, and the implementation of this idea of expansion. And it comes from what SAMHSA has been really attempting to do with this concept of a theory of change. Next slide, please. And historically, hopefully we'll have some background, and if not, just as a reminder, our program really began in the early to mid-1980s, when it became so evident from the work of people like Jane Nitzer, and when she wrote Unclaimed Children, documenting the fragmentation of different systems and how systems of care come together to provide that comprehensive and coordinated approach. And that really moved into the current program that we operate, which is based on legislation that was passed in 1992, where the program itself then initiated in 1993. And we've had many different historical grants since the time of the program inception. And what we've done in 2011 was this idea that while we have wonderful experiences with communities and programs all over the country, that what we really wanted to start thinking about was to expand. And that's where this expansion grants came from in 2011. We've been able to do more of those in 12, and then move into this implementation awards, which these, leveraging funds. So we have money for planning, but now, 4 years, $1 million a year, and frankly, know that that's just a small amount in many places. But the idea, again, is to use the money, the leveraging, for other kinds of things. And we've been successful over the last several years. And last year, we gave out an additional 11 planning grants and 15 implementation grants that were awarded what we called off the shelf. Now, that means that we had so many applications so many applications in 2012 for the expansion planning grants that we kept them around for another year. That we were able to have dollars in 2013 to award those off the shelf, which means that they were literally sitting on the shelf waiting to get awarded, and they were like, wow, this is really amazing because we thought we didn't win, and now all of a sudden we got more. So those things are possible. I'm not, without hope, because you never know in terms of the funding, and, I mean, everybody's probably watched TV like me, and of course we were furloughed for a while, so, Congress is going to ultimately appropriate. But the truth is that, once you write the applications, we keep around for the current year and a follow-up year, depending on whether we have additional money. Next slide, please. I'd like to say to people to do a great job, and even if you've missed school here or there, that that we score to a fundable level, and so if it happens, then it's great. So on the now these original CMHI awards, the ones that we did from '93 to 2010, located all over the country, including of tribal nations, inclusive of territories, Puerto Rico, Guam. Really, this last year, our system of care planning grant, we have one in Lao, and from Maine to Florida, and you get the picture. Systems of care everywhere, and we'd like to see those dots on the map actually expand and color the map in so that a system of care, our approach to serving children who have serious mental health challenges, becomes not just the way of doing business, but it is the business of children's mental health. Next slide, please. And the last several years, as we've gone forward with our planning, expansion planning and implementation grants, you can see we have a new map, and those areas as well. We're still across the country trying to get the word of the importance of doing this work. And so perhaps your local community, your state, your tribe, your territory could, be. I don't know, we'll have to come up with another. I see a square and a red. Well, we'll do something anyway for the next iteration of 2014 and going forward on there. So we're really excited about this opportunity, and that we've had the ability through our appropriations and our leadership here at SAMHSA to maintain this approach. Next slide, please. Then I'm going to harp on a little bit is maintaining the consistent values and principles that systems of care have. We often will bring out our transformation equation to remind folks that, as several years ago when we've identified this approach to transforming systems, is that we are a values and principle-based approach that has wonderful outcome data about the impact and effectiveness. So we're combining conceptualization with data, with evidence, leading towards positive outcomes. And in fact, I'm just reviewing another one of our reports to Congress and looking at what we're accomplishing in terms of improving functioning and systems across the country. And so the transformation equation simply is our transformational approach equals your vision, sort of the direction that you want to take. And again, it's important that the reviewers know where you're headed. What is that direction? Your beliefs, and our belief system is written here. Being family-driven, youth-guided, culturally and linguistically competent, incorporating data and evidence-based practices and evidence-informed practices, as well as our clinical excellence. And then also the idea of continuous quality improvement. We share that because of the importance of getting feedback from people, and so how you incorporate families and young people into your application process, into what you're doing. Our reviewers will be looking at that, and that is really critically important. What kind of populations are you serving and meeting those needs? Our program has done a great job of meeting needs of many underserved and of populations, and so how is that working? What can you bring to bear to show that your locality, your community, your state, whatnot, tribe, territory needs this grant, and what you're going to do with it? And that's what the transformation approach is all about. Next slide, please. We have important contexts right now that I think folks should. You'll see many bullets in the different sections about financing, about structure, governance activities, and oversight. And the context that we're working in right now really is important because of service delivery activities. And these that I really point to are what we're working closely with our colleagues at Medicaid and the Centers for Medicare and Medicaid Services. Last May, hopefully folks will know and perhaps remember the joint informational bulletin that was put out regarding coverage for different kinds of services for children, youth, and young adults that have significant mental health conditions, and all the services that Medicaid identifies in there that can be paid for through Medicaid, waivers by the 1915 which, by different strategies that folks can hopefully use that can get paid for the sustainability of this. And these are the things for us that really are critical as part of the overall process. And I think that when you are designing your system and looking at what's available, what can be paid for, what can be sustained, we've really put together with our colleagues at CMS a nice approach, a nice strategy to provide services going forward, and also getting them paid for, because, again, the majority of the youngsters that are involved in our systems of care certainly have Medicaid. We also have youngsters that have third-party insurances, and so we're focused on bringing those folks in as well, if at all possible, and then those that are uninsured that may be able to get access to insurance if you can link them up with new health insurance exchanges and stuff. And then just this past Friday, CMS has just issued a final rule on home and community-based services, which, again, is going to be, there's a 60-day processing period, but if you haven't seen that, or perhaps the fact sheets that can come out that CMS has that you can download more specifically, but really looking at strategies to provide services, in this case for elderly and disabled populations, and those include those that need behavioral health services. And so between these ideas, the service delivery, the availability of the kind of services we believe are critical for system of care can and will be made available, and we would like to leverage what we're doing through our infrastructure, through our services, to move that forward. And I would strongly encourage people to find ways to demonstrate those linkages between what we're trying to accomplish with these dollars and the long-term approach to creating the system of care. Next slide, please. And there, our next step, which is how you demonstrate the system of care approach through application. How you demonstrate what kind of service delivery systems that you're working with. I mentioned Medicaid and third party, but also we really are work very closely with our colleagues in child welfare, juvenile justice. We now have more referrals than ever before from primary care. How are you going to link with education? What populations are you going to focus? Are you going to be looking at? Is it broad? Is it specific? And why? I mean, that's a critical question. Again, painting that picture for a reviewer to understand that this is critical need, and here's how we're going to meet it, and here's why it's going to work, and we're going to participate in the data collection in order to do that. How those community and residential settings are working together, how, if you're doing, say, adolescent young adult population, how those are bridging. And again, we continue to focus on data and the ability to incorporate evidence-based and promising practices into our work. Partners and collaborators, obviously, and not just their traditional. We really have expanded. I've been talking a lot lately when I spoke about how we're working much closer with faith-based organizations and marketers and trying to get business leaders involved and folks that might provide vocational training and mentorship for our young people. I mean, things like that where, wow, this would be really, it demonstrates that kind of a system of care. And ultimately, your implementation drivers, who's going to be in charge, leadership, the competencies that people have, the organizational capacity. So next slide, please. There are several questions that we've been fielding of late, and I thought I would make a couple of comments about your application itself, how to address certain issues. And so in my last 5 or 6 minutes, I really want to help folks understand that we've changed the eligibility a little bit. And so the biggest issue for us is, one question has come through, is can we apply for both a planning RFA, and the implementation RFA? And I'll say first is that the first thing you have to do is to meet all the eligibility requirements. So it's statutorily limited to public entities. Now, that's critical because if you have a question as to whether you're a public entity, we try to respond to that, or you can get your attorneys that are involved in the public entity. So we've had states, for example, or subdivisions have a letter of support or demonstrating, like from the state's attorney general's office, indicating that this is considered to be a public entity government subdivision within a particular state. So a particular school district or a public health agency, all of those kinds of things can qualify. The Indian and tribal organizations, and then those government units such as counties and towns, all of our territories and are part of the District of Columbia. All of these have statutory authority for applying to the program. You have to meet that. If there's a question, then please check it out with us. With my Deputy Branch Chief, Diane Sondheimer, responds to a lot of the questions about eligibility. If you have demonstrated that you are eligible, then your question is, can we do an implementation or a planning grant? So starting with the planning grant, so they apply for, if you're eligible under that criteria, and you've not received historically, either received or are currently receiving a planning grant, then you're eligible. Trying to restrict this to folks that have not received the planning grant before, because we want to try to expand what we're doing. So that the planning grant itself is just for new folks that qualify. For the implementation grant, those entities that are currently funded, those that you cannot apply. Let me say it this way: you cannot apply if you are currently funded through an expansion implementation cooperative agreement. You just can't do that because that's not, we're trying to spread it around a little bit. And we want to give some high priority to folks that have demonstrated their strategic planning. You do not have to have had a planning RFA in order to apply for the implementation RFA if, in fact, you can demonstrate some evidence of your strategic planning to sustain, and expand systems of care. So, that's not a requirement. So hopefully that's clear. You do not have to have had one of the former planning grants to apply for the implementation grant, but you do have to have some evidence of planning for an expansion of systems of care. So those are the things. The other question is, can we apply for both? In theory, yes, the answer is yes, you can. There's nothing that prohibits you from doing so. What we will end up doing, however, is that if we will award one. So if you end up getting the planning one and not the implementation, then so be it. Those historically that have qualified for both and made under that same situation where you have both, and you'll look at this and say, okay, well, we've applied for X amount of dollars under planning, but since we've sort of done all that already, and now we have a $4 million 4-year, $1 million a year for 4 years, the folks historically have opted to choose the implementation one because we will not do two at the same time. So you'd have to make that choice. But the ultimate answer to the question is, can we do both? Yes, you can. Next slide, please. In terms of some of the points, if you look at the scoring criteria, that's carefully crafted, that you will see that there are specific points given to various things. The importance of explaining to the reviewers about how you're addressing the expansion issue and justifying what your geographic area is. Having explanation. If you're a planning grantee, you can do up to $800,000. And so if you're doing that, obviously, if you're a state, doing that, you need a lot of money for that. If you're a very small area, you may choose to ask for less money or if you want to ask for the full amount, you need to provide a rationale for that so that the reviewers can understand. So I use the example if you're a small subsection of Texas versus the entire state. Well, there's a little bit of difference in a viewer piece. If both asking for $800,000, why that might be. So those are important things to do. You need to really focus as part of this description of the team that's involved and how the young people, youth, and families are involved. It is such a core piece of what we do, and the issues about sustainability and the financing strategies. I often will remind people that in many ways, the service delivery resources that are part of this, while we do some and that it is part of our overall system, that the majority of those are actually provided by others, particularly Medicaid, but third parties as well. And so how to link that and how you're going to move in your financing structures to create the broader systems of care are critical, because that's the stuff that I will be saying to the reviewers when I orient them to the overall process. So this is basically the same message that I will be giving to the reviewers that you're hearing now, which has to do this. You also, again, if you have a priority population, how you're going to address that rather than everyone, and then ultimately meeting match requirements, evidence of your support from the broader state, like a governor or the designee or a tribal territorial designee. Those are the kinds of things that you need to do in order to make sure that your application goes forward. And please, implore you, please follow all of the rules regarding fonts and sizes and margins and word counts and submitting it through grants.gov. Try this in advance. Get your DUNS numbers. Get everything lined up in advance. And if it were me, I'll just say this. I would try to submit the application a week early. Why? Because I can't tell you how many times it's so sad that something happens, that's your fault in essence. Something other than that the government shuts down or, the grants.gov isn't working or something, but, that where something happens and the transmission isn't sure, you're not positive, please in advance try to make sure that you are ready to do that. So all of those things, we are accepting these, grants applications now, only through grants.gov online, unless there's some kind of major waiver process. If that's the case, then we need to hear from people right away in order to ensure that that's allowable. But otherwise, we use the electronic submission process and have to meet the requirements. And just because your computer screen says that you have X number of words or something like that, has to be lined up and consistent with what grants.gov's computer screens are going to have. So just, again, I really, really recommend that people prepare ahead of time to do this, and it'll give yourself a little bit of time to make a mistake or have a problem in transmission so that you don't lose out at the last minute. And, and unfortunately, grants review process is a legal one, and as a result, that people don't get extra time. If you don't meet the deadline, it's over, and that if you're not following the margins or whatever, then there's nothing that we a program can do to change those sorts of things, because it's all governed by rules that are beyond us. So overall, that's what I wanted to share as a preface to this. I've noticed that there have been some questions that we have. Yes, the PowerPoints are going to be made available, and again, in order to be fair to everybody, that this is documented. We have everything. So I'm down here. So I'm going to sort of throw it right now and give a few minutes for any further questions. Apparently, you need to hit #6, but I think we're all supposed to be cool now and say #6 to unmute your phone. If you're online, you can write your question in the Q&A box on the lower screen, and then when you're done, you'll hit *6 to re-mute again. And so I'm trying to get some masses on this. So the first question that I have, maybe Marlene can help me, is it on page 7 under expectations? It says that Senate grants can be used for services.
Barb, I'm on a call, baby.
Yes, you are.
You want to read it out loud?
Let's see. Can be used for services to individuals are ineligible for public or commercial insurance. Does that mean that any Medicaid eligible children? No, that is not true. That as part of our overall system of care, all children are eligible. Our question here, the real issue here in terms of SAMHSA grant funds, that we're providing the infrastructure, but you can get services however you can, whether that's through Medicaid or through commercial insurance programs, that the revenues that you can, bill for, it may be your agency, or a subcontractor or somebody else that's doing the services, you can bill with the way that you normally do. You can't double dip. So that's really important, so that you can serve any children. And I would add that the one caveat is that for those entities, really, except for specialized group tribes, you cannot. The real question is that you may not use those dollars, those revenues from Medicaid, to do the match. federal funds cannot be used to match other federal funds. So as part of, if you're doing the planning, or in this case, this would be an implementation grant, that those funds cannot be used for match. So it would be separate from outside of that system. You may absolutely serve children that have resources.
The question is, do I understand this correctly, that nonprofit agencies are not eligible to apply?
The only eligible applicants are government entities. Nonprofit agencies absolutely can participate, and in fact, oftentimes they receive subcontracts from the government entity to do the services, to do the project management, to do the coordination. I mean, a whole host of things, but you may not be the fiduciary, a government entity, and that's a statutory requirement of this program. And so if you're interested in learning more about that, you can always look up the statutory requirements for this, but the specific language is contained in the statute, but it is limited to public entities, and it includes on that eligibility slide that you should probably see, state governments, governmental units within political subdivisions of a state. So counties, cities, towns, whatever, are all eligible, and they often will partner. So that's the answer to that question. I hope that was at least explaining appropriately.
Okay. The next question is, you note that you are looking for the greatest geographic area. Does that mean smaller counties should not apply?
No, it does not mean that. We are looking for cities to expand and sustain systems of care. Now, that means greater geographic areas, we want to have an impact on them. And the statute is very clear that all government, geographic areas, the government entity itself that it covers, its catchment area, if you will, are eligible to apply. You just need to demonstrate the rationale for why you're doing that, and perhaps, so as an example, that you may be or create a consortium of smaller areas, or you may say that our area is going to be the pilot program, and so our state is going to use us, and that depending on what we're learning, we're going to create a statewide committee that will be looking at various ways to expand to. So there are strategies to do that. So the answer to that is no. It does not mean that you should not apply.